first year has revealed what we all expected, a vast amount of silent good work, a great deal of relief, and a great deal of gratitude.
Nye Bevan's devotion to establishing the National Health Service was inspirational. Don Atwill was among the multitudes he inspired.
His direct influence actually persuaded me when I left school to become a trainee administration manager in the National Health Service, and that was at 16 years of age.
But you were working with medical records at the beginning?
Oh, absolutely. I was booking in outpatient appointments, meeting the patients when they arrived, checking them in.
60 years on, Don's talent for keeping records is a skill that's helping his very survival. Every week, 3 million people use the NHS. The notes relating to their hospital treatment are often stored in depots miles away. Medical records kept on sheets of paper. Many, many sheets of paper. This is a typical medical records library. There are scores like this all over the country. This is in Birmingham, where there are 1.4 million patients' medical records being kept, and they go back decades. But the system is cumbersome, complicated, and it's collapsing under the weight of so much vital information stored on paper. It's just not working.
My experience has been that notes are never where you want them to be. If you want them in cardiology, they may be in orthopaedics. If you want them in orthopaedics, they may be with the kidney team, etc. And patients with multiple problems under many departments may have their notes all over the hospital, maybe 2, 3 or 4 files in different places.
And it's causing real problems for patients, is it?
Well, it causes terrible problems for patients. You can imagine coming to clinic with a complex medical problem and seeing a doctor who's got one thin folder with a blank sheet of paper saying temporary notes, can't find the notes.
For 25 years, Don Atwill's had a chronic heart condition. These days, he minutes and logs every hospital appointment and test result for himself. He's learned from experience. When he goes for treatment, and he's been everywhere, too often his medical records won't turn up. From his local hospital in Chester, he's been to London, Liverpool, Cambridge, Cheshire, Bristol, Manchester, back and forth, again and again. The health service should have built up a large file on Don Atwill, but if they did, we'll never know.
I've arrived for an appointment at a hospital and was greeted with the comment, I'm sorry, we've got bad news for you. And he says, you can't make this up, but we've lost your records.
Lost your records?
Lost your records.
What sort of records?
25 years of clinical records reporting have got lost.
As Don will tell you, when the records aren't there can be trouble.
I'm in the cardiac ward and a consultant comes to me and says, I want you to take this tablet. And I said, I'm sorry, I can't take that, it'll have an adverse effect on me. And he said, I won't give you any other pain medication unless you take it.
What?
So I took the tablet involved and I regained consciousness. I was on the floor, my feet elevated, receiving an intravenous drip to try to recover my blood pressure.
It did that much harm?
Yeah.
To avoid such potential catastrophes, University Hospitals Birmingham has become one of the first to transfer all its paper records onto computer. David Rosser, the medical director, says it means confusion over the likes of drug doses has been dramatically reduced. Are you saying it makes difference to patients' mortality going onto computer rather than being on paper?
Yeah, we've just published something in a scientific journal that demonstrates a more than 16% reduction in emergency mortality, which correlates exactly with a reduction in the number of missed doses of drugs. So give patients the drug that they're prescribed and fewer of them die. So we now have 100 patients a year fewer dying in this organisation than we did 3 years ago.
So in Birmingham they say computerisation's helped, and they're going further, trying to give patients access to their records online. Ellen Ward-Lindley, who has rheumatoid arthritis, is one of the first to benefit.
What you can get on the system now is they can show a little graph over time. So my iron levels, being a perfect example, started dropping off around November last year, and it wasn't quite so obvious until you could see it in graph format, and there it was, just plain as day, just...
So you feel better informed?
I do, and I have more of a basis for asking questions.
But Ellen works in the NHS as an information analyst, so, like Don, she has an aptitude for statistics. What's happening here in Birmingham plays into the idea of giving patients freer access to their own medical records. It's an idea that's increasingly popular with medical bodies like the Royal College of Physicians. But others argue in the long term it'll simply mean doctors shuffling off what's currently their responsibility onto those least able to cope, their patients, the sick. The government has said by getting access to their notes, patients will have control over their treatment. So it's right in line with government thinking, and leading doctors' groups are also keen.
For most, I think it is very welcome. They want to move in this direction, but it is because they want patients to have the opportunity to manage their own disorder, to make decisions.
It's opportunity, but is it responsibility as well?
It carries responsibility.
So yes. The patient has responsibility rather than the physician?
Not rather than, as well as.
Duncan Diamond, a consultant for 40 years, says patients should be informed, but warns full access to their records will create further problems.
I struggle to see how that's actually going to put the patient in control, because a lot of the medical records will be using terminology and numbers and things that nobody outside the medical profession is familiar with. And that seems to me introducing yet another potential gremlin into an already difficult system.
What about the notion that the patients could be at least the backstop? At least they'd have control over their own.
How do they coordinate it? They can come in and say, hello, Dr. X or Dr. C, I saw Dr. A and Dr. B, and here are the records which your organisation is unable to find, so I've got them. It still is a terrible indictment of the system that relies upon someone who's ill and vulnerable and maybe not at their best, worried, anxious, with anxious, worried relatives, to produce an administrative process which the hospital should do.
At the Royal College, they accept that to take or even share control of their notes, patients may need a degree of sophistication.
What happens to those patients who aren't sophisticated?
Those patients probably won't pick up the challenge and will continue to feel that they want to be managed on a rather one-sided basis.
And what will happen to them then?
Well, we continue to do it that way. But for those patients who want to engage much more in shared decision-making, shared management, we're right up for it, and we want to see that.
Some, like Don Atwill, see this as blind stumbling towards a two-tier health service, with patients in the know, like him, OK, but the rest left floundering.
Because I've argued, I've chased, I've provoked, but you can't expect the ordinary person to do that. It's not feasible.
And ever more removed, he fears, from the dreams he still nurtures for the NHS.